Welcome to our video abstract, Healthy Leadership in Crisis, Effects of Health-Oriented Leadership in Turbulent Times, a study by Laura Klebe, Jörg Felfe and Katharina Klug from the Helmut Schmidt University in Hamburg, Germany. During a crisis, followers' health and performance are at risk, for example, because of increasing time and performance pressure or increasing workload. When leaders engage in health-oriented leadership in terms of staff care, they can increase their followers' health, for example, by being aware of health-related warning signals or by actively promoting health behavior at the workplace. However, previous studies did not investigate situational influences on health-oriented leadership. Therefore, we wondered whether staff care is more or less effective for followers' health and performance in crisis. We conducted two studies. Study 1 was an experimental vignette study with 257 participants. We systematically manipulated team crisis and staff care as independent variables and follower strain and extra effort as dependent variables. Study 2 was a cross-sectional survey study with 196 participants. As independent variables, we measured in how far employees' work environment was affected by the COVID-19 crisis and their leaders' staff care. As dependent variables, we measured followers' exhaustion and their task proficiency. So now let's see whether staff care is more or less effective in crisis. When leaders displayed staff care, we found a decrease of follower strain and exhaustion and an increase of extra effort and task proficiency. Moreover, when a rather small team crisis occurred, follower strain and extra effort increased. For followers that were affected by the COVID-19 crisis, we found an increase of exhaustion but a decrease of task proficiency. During a small-scale crisis on the team level, the effectiveness of staff care for followers' health even increased, but the effectiveness for their performance, in contrast, decreased. The effectiveness of staff care for followers' health also increased for followers that were affected by the COVID-19 crisis. However, regarding staff care's effectiveness for followers' performance during the COVID-19 crisis, we did not find any changes. So now, is staff care more effective in crisis? Yes, we found an increasing effectiveness for followers' health. However, we did not find the same for followers' performance. Instead, we found a decreasing effectiveness for performance in team crisis and no change in the effectiveness for task proficiency during the COVID-19 crisis. Our study shows, even though it might be more difficult for leaders to display health-oriented leadership in crisis, it becomes more important for followers' health. Future studies should clarify the contradictory interactive effects on performance, test longitudinal effects of health-oriented leadership for followers' health in critical periods, and investigate the levels of staff care in crisis. To foster followers' health in crisis, leaders should value followers' health, be aware of health-related warning signals, and actively engage in health-promoting behavior. Thank you very much for your attention. If you have any further questions on the study, don't hesitate to contact us.